Hi, my name's Marissa Thompson, and I am a part of AHEC's Cohort 6, and I have a public health background. So, my past 2 years with AHEC have meant so much to me. I have learned so much more about the field of health beyond my scope of public health. We all get into our little bubbles in education, and those are wonderful, and you learn a lot there. But when you get to experience AHEC, they help you branch out. This past week, I got back from a community health immersion, the natural and alternative medicine one, and I was alongside nurse practitioners and pharmacists and physician's assistants, so many different great individuals as students. But then we also got to learn from a naturopathic doctor, and we went and learned about tribal health and tribal food sovereignty, and we learned from community health workers and dietitians and homeopathic remedies. And so we just learned so much. It really expands your understanding, and that's what I have to say. AHEC has made me such a more well-rounded health professional going into the field, and I am so grateful for my time with AHEC, and I love it, and I hope you do too.
Hi, my name is Becky Cronebush, and I just finished my AHEC Scholars Program in the Scenic Rivers region of Wisconsin. Because I live in Minnesota, I'd never heard of the AHEC program. But because I work in Wisconsin and chose a school in La Crosse for my Doctor of Nursing Practice program, I had the opportunity to discover AHEC and all it had to offer. When Brianna, the Scenic Rivers program director, first came to discuss the program at a class, I was immediately intrigued, but I had to ask if I was the type of person that would fit with the program. I'm already 20 years into my career and practicing as an advanced practice registered nurse for the last 10 years in a job I love as a clinical nurse specialist. I was so glad AHEC accepted me, and I've tried to soak up every learning opportunity offered over the past 2 years. The highlights of my experience were the community immersions. There are a lot of different ways that AHEC offers to complete the requirements of the program, but going to discover new areas, cultures, and health needs really aligned with my interests. I love the Ashland, Wisconsin area, but hadn't been there in a while, so I chose to attend a natural and alternative medicine immersion for my first one in that area. It was a learning opportunity about Indigenous midwives and birthing practices. I was able to see a rural community hospital in northern Wisconsin, and we visited the Bad River Tribal Health Clinic, who were so welcoming to us. The second immersion I did was a hybrid immersion, and we heard Native Nation stories of trauma and resilience, and had some pre-work before that was very valuable before we all met together at Lake of the Torches, or Lac du Flambeau. Members of the tribe hosted us for an Indigenous lunch, and we learned about the area. Went on site to a boarding school where we learned about children as young as 4 years old being ripped away from their parents in what was termed at the time, kill the Indian, save the man. We also visited a tribal health clinic on the reservation, and the welcome we got again was so wonderful. Other experiences with AHEC were live webinars of those working in different fields that gave me great insight to work different from mine. I loved learning about community health workers supporting the Amish and Mennonite and tribal communities, as well as Hmong cultural beliefs with a Hmong shaman presenting, and finding different areas to discover with placement to support rural and vulnerable populations. I loved everything about the AHEC program and that they take all types of students like myself ready to learn and grow. I've since graduated from my Doctor of Nursing and Ethical Leadership program at Viterbo University in La Crosse, and I'm taking all of these experiences with me, and I'm so grateful for this opportunity, for AHEC, and for the program directors coordinating these amazing experiences. Thank you.